Hello, in this video I'm going to be talking about dry eyes in people on endocrine therapy, and I'm going to focus predominantly on people on aromatase inhibitors. Before I go on, I want to invite you to subscribe to our channel. We are always putting out new content, and I have to tell you, this topic and many other topics come because you ask us to make these videos. So if there's a topic you're interested in, drop it in the comments or question below, and the next thing you know, it'll show up on our channel. I'd also love to invite you to go to Yerbba.com to get your personalized report. I'll be talking about hormonal therapy today in the treatment of breast cancer, and if you're wondering, am I going to be offered endocrine therapy with aromatase inhibitors or tamoxifen? Maybe these are words you haven't even heard yet. Your Yerbba report will take all the medical information that is available on you and cross-reference it with the latest medical evidence, tell you about treatments you might receive, what to expect with each, the pros and cons of each, and it even gives you a set of questions from which to choose to take to your medical appointments. Dry eyes are some of the most uncomfortable things you can have. If you haven't had dry eyes before, I can promise you that dry eyes decrease your vision, make it harder to drive at night, make it really uncomfortable to be in heated areas or air conditioner, or areas where it's very windy. It can be hard to read if your eyes are not making sufficient tears. You may also find that people with dry eyes actually make more tears. So people with dry eyes can have really runny eyes because their eyes are trying to make more tears, and this can also be upsetting to people. But I'm going to focus on dry eyes, the sensation of blinking, because people with dry eyes tend to do that you have sand in your eyes or that you're just not getting enough lubrication. And guess what? You're not. On aromatase inhibitors, because of drops in estrogen below physiologic levels, so these are lower than when menopause happens, they're lower than if you have your ovaries taken out. These low levels change our tear composition, so there's less mucin. That's the lubricant, that sort of gooey lubricant that's in tears, believe it or not, and it makes your tear film thinner. So every time we blink, we spread the tear film. If it's really thin, it evaporates more quickly. An eye doctor actually will do a time test where they have you blink a couple times, and then they'll time how long it takes for your tear film to disappear. And in people with dry eyes, if you're having problems with tear production or composition, you will see that that tear film breaks up really quickly. There are things that can be done. I do want to stress that this is a known side effect of the aromatase inhibitor since 2013. This was documented. It was not one of the earliest side effects. It didn't surprise any of us, but this required a specific research question, and indeed dry eyes were found to be more common in people on aromatase inhibitors compared to age-matched controls. So our eye tear film changes as we get older, but it's more affected in people on aromatase inhibitors. One thing that means is that it's probably reversible when you come off the aromatase inhibitor. The other thing it means is that it will last as long as you are on the aromatase inhibitor. So I'm going to give you some tips how to handle this. One thing is, don't forget to blink. I know it sounds crazy, but when we watch television or we're on our computer screens, we tend not to blink. We stare at things. This can happen when you're on your phone. So if you can just spend a minute becoming aware of how little you blink, you can recall that blinking, and sometimes a nice, slow, hard blink, can bring you some relief. The other thing that can bring you relief are lubricating eye drops. There are so many brands. The store brand is fine. They are not cheap. You will find that if you have a health spending account or a flexible spending account, that you can use those accounts to pay for lubricating eye drops, which is one good thing. That's tax-free money that you're using to pay for your eye drops. There's some that are very thick. I do not recommend using those if you're going to be reading or driving, because it can make it hard for you to see. They're that thick, but you can use the really thick ones at night, which can help you be more comfortable. You may find keeping your drops in the fridge makes them more soothing. So if they're not in your pocketbook and out and about with you, and you're at home, keep them in the fridge. And your morning eye drops and your bedtime eye drops should certainly be chilled. Make sure on the bottom it doesn't say you have to keep them at room temperature, but most lubricating drops do just fine in the fridge, and it feels so much better, like 10 times the relief. The other thing you can do is you can make sure that there's moisture around. So you can have a humidifier in the winter. Make sure if the fan or air conditioning is running, it doesn't blow on your eyes. So you may find, for example, a ceiling fan or a bedside fan is not good for you. It's hard to think about all the things that might play a role, but just be aware of your environment. Dry eyes is as much an environmental issue as it is a personal body issue. The other thing to do is consider seeing an ophthalmologist. There are specialty ophthalmologists who deal with dry eyes. Ophthalmologists can insert a plug into your tear ducts on the lower lid so that when the tears come from the gland, which is in the right above the upper lid, the tears are not so quickly absorbed into the lacrimal gland. The plugs are really painless. You don't feel a thing once they're in. They come out naturally, sometimes on their own if you rub your eye. It's not very expensive a procedure for an ophthalmologist to do. It's not done under general, it's really straightforward. For some people that provides relief. And there are other things that can be done. So if you're really struggling with dry eyes, seeing an ophthalmologist who has an interest in dry eyes would be a good next step. I've covered a lot. This is a really common symptom. Up to 25% of people on aromatase inhibitors. So you are not alone. It's very real. You're not imagining it. And there are things that can be done. Thank you for watching, and we'll see you next time.